Okay, so this is where we're going to spend most of our time, which is specialty practice accreditation. We did introduce this January 6th, this year, 2022, with a president's message. I did include a link there to that president's message for those that want to take a look at that. And really what it is, it's a new accreditation type for non-sleep practices, but specifically those of cardiology practices at the moment. So eligibility is only for cardiology practices. And the reason why this was introduced is because it does support AASM's strategic plan, which is establishing enduring models for collaborative sleep care with other care partners. Now, in order to do that, and I kind of have this statistic here, which is 30 million adults in the US have OSA. 24 million are undiagnosed. So we need this to establish collaborative sleep care so that we can prove access to care for patients, okay? And in order to do that, then we have to collaborate with what are other care providers. Now, cardiologists are considered the high priority partners. And in the next slide, I'll get to why cardiology and cardiologists are considered those high priority partners. But I think it's worth noting before we get to that slide that this program was piloted by a large cardiology program, so Cardiology Consultants of Philadelphia, for over the past 5 years. And their partnership and the relationship that we had through this pilot was recently highlighted in the Montage issue, the summer 2022 issue. And I have a link to this as well if you're interested in taking a look at it. But it is a good article, and it talks about how we've continued to refine that program over the past 5+ years in order to get to where we are today with that program and the standards that support that program. So why cardiologists? Now you have quite a few stats here, which is 40 to 80% of patients with cardiovascular disease are more likely to have comorbid obstructive sleep apnea. 85% of people with treatment-resistant hypertension also have sleep apnea. 58% of middle-aged men with severe sleep apnea have an increased risk of developing heart failure. 50% of diagnosed patients go untreated. 2 to 4 times higher risk of atrial fibrillation found in people who suffer from sleep apnea. 30 to 40% of people with high blood pressure have obstructive sleep apnea, and 2 times higher risk of having a stroke for people with severe untreated sleep apnea. So as we read through these stats and we take a look at really what this means, we can see how cardiologists, the field of cardiology, aligns with sleep medicine disorders. Okay, and so that's why cardiologists really are considered, high priority partners when we think about a collaborative care approach. I do have 2 additional resources here that I definitely think are worth taking a look at too. Obstructive sleep apnea and cardiovascular disease. So it's a scientific statement from the American Heart Association, and then sleep and cardiovascular disease, an overview. And that's from the National Library of Medicine. So specialty practice accreditation, what is it? How does it differ? I think to be able to answer that question of how does it differ, we kind of need to understand, our other accreditation programs. So I'll briefly just touch base on that, and then we can get into what are some key differences. So sleep facility accreditation. So this is a comprehensive sleep program. It has the clinic where patient evaluation and management occur, and then it has the laboratory where there's diagnostic testing for in-center, and then also home sleep apnea testing. Independent sleep practice accreditation is a sleep practice, and it manages patients with sleep disorders and performs home sleep apnea testing as a means of its diagnostic testing. Now, it is worthwhile that an ISP does have to have a relationship with an AASM accredited sleep facility for the purposes of in-center testing when indicated. And that relationship is very similar then to specialty practice accreditation. We'll get into that here in a little bit. So a specialty practice accreditation then is a non-sleep medical practice. Now, it manages their patients by screening for sleep apnea and then performing home sleep apnea tests, but facilitates to an AASM accredited sleep facility for in-center testing when indicated, and patient management of their sleep disorders. Okay, so let's take a look at then some of the key differences. The first thing is that it is a non-sleep practice. In this case, cardiology practices. Second, it requires a good relationship with an AASM accredited sleep facility. One, for the in-center testing when indicated, but for the entire patient management aspect of that patient for their sleep disorders. Now, I do stress, that it requires a good relationship, because there's things in the standards that do require that specialty practice document certain things, such as when treatment was initiated, treatment compliance, ongoing treatment assessment and outcomes. So in order to document these type of things, they have to be able to have a relationship to be able to gather this information from that accredited sleep facility. And then now, with this information, the specialty practice can then continue to treat the patient for cardiology disorder, knowing that their sleep disorder also is being treated. It's once again, that collaborative care approach. And then the last thing that's worth noting is that specialty practice accreditation requires a certain standard, requires that the specialty practice is unable to accept direct referrals. So really what that means is that the specialty practice is not within the local community the practice that should be receiving referrals for sleep disorders or sleep disorder testing. That should still go to the AASM accredited sleep facility, or that'll go to the sleep practice. Okay, really what the specialty practice is doing is screening their patients and then sending those patients off to that accredited sleep facility in order to be able to manage those patients' sleep disorders. And so it's a way to improve access, because these are patients that would not have ordinarily been tested otherwise. Some general information: the accreditation fee is $4,500, and that is for a 5-year term. So once again, when we think about how this relates to even our other accreditation programs, it's very much the same here at $4,500 for a 5-year term. So the AASM's fee per year structure is the most competitive there at $900 a year. A specialty practice can add additional clinic locations if they want to, at an additional fee of $500. So why pursue collaboration with cardiologists? So I think that's an important question. And the reason for it is because it will help facilities, or by facilities working with cardiologists, it will improve access to care. It's going to expedite continuity of care, and it will demonstrate to both patients and payers that the highest quality of care is delivered in the pursuit of both heart health and sleep health. Now, once again, really it's a means to screen and test patients that would not have ordinarily received a test. And then it also provides a collaborative care approach to expedite patient continuity of care and thereby see improved patient outcomes. I thought we'd talk a little bit about sleep facility benefits. I do think that there are 3 perspectives in terms of benefits of this program. I think you have the benefits to the patient by having a collaborative care approach. And then I think you have the benefits to the specialty practice, so the cardiology practice, by being able to screen their patients and refer those patients over to an AASM accredited sleep facility. But then there's the sleep facility benefits as well. And because of the target audience for this presentation, we're primarily just going to focus on sleep facility benefits. So first, it does ensure that sleep facilities and board-certified sleep specialists are at the center of managing patients with sleep disorders. So the cardiology practice does screen their patients and then facilitate for in-center testing and for the patient management, all to the board-certified sleep specialists and accredited sleep facilities. Second, it demonstrates the desire to improve collaboration between other healthcare partners. So we talked about that collaborative care approach, thereby improving sleep care access and patient health. And then third, because of that collaboration with other healthcare partners, we will see an increase in referrals to the sleep facility for in-center testing and to the board-certified sleep specialists for management of sleep disorders. Now, because of the increased referrals, that means higher patient volume and then thereby increased service reimbursements. So I think there's two additional resources that are worth highlighting here that talk about the benefits in terms of a collaborative care approach, improving patient access through a sleep cardio type program. So improve access to sleep apnea care through cardiology practice accreditation. That's by Cardiology Today. And then secrets of a successful cardio sleep program. And that was published by Sleep Review. I have one additional resource that I think is worthwhile taking a look at that talks about the alignment of cardiology and sleep medicine. That is a podcast, so a talking sleep podcast put out by the AASM Season 4, Episode 1. That was by Dr. Khosla and Dr. Redline, obstructive sleep apnea and cardiovascular disease. So the last link in terms of additional resources to really stress why this program is important. And then two additional resources here: specialty practice accreditation standards for accreditation. So certainly taking a look at those. And then to the specialty practice accreditation webpage. Looking at that will be helpful because there's a lot of additional maybe FAQs and directing you to an accreditation application for specialty practice accreditation. So you can kind of also see what else the application entails.